Hey everybody, Cody Barnett, Bodyworks Physical Therapy and Concussion Center, and we're talking today about the rotator cuff, or as some people like to call it, the rotator cup. But here's the deal, there's no cup, it's just a cuff, and it's four muscles. And so frequently when we read about it in the newspaper, or you hear an athlete that's been injured, you think that the rotator cuff is a one thing. It's actually four things, it's four muscles. We have two muscles on the back side of the shoulder, one muscle that sits over the top, and then one muscle that sits across the front. All of those muscles come out onto the bone, and that forms the rotator cuff. So when we say we have a rotator cuff tear, you could have a tear in any one of those muscles. Here's the interesting thing. By the time we're age 65, about 40 to 50% of us will have some degeneration or even some tearing in one of those muscles. And so the really kind of interesting thing about this is that it's kind of an aging thing, unfortunately. It's like gray hair, it's like having bad eyesight, losing our hearing. Over time, we can just get some wear and tear in those muscles. And to be honest about it, a lot of people live with that their whole life and don't even know it's there. So when you come in with some shoulder pain, the best thing is first we just need to do a really good, thorough physical exam. And with a physical exam, we can nail down a lot of things that are going wrong with the shoulder and identify what's going on. And if something is going on, there are times where we may need to refer you to your physician to get some imaging done. But there's an awful lot of conditions that can be taken care of just with a little manual therapy, the correct strengthening, the correct postural positioning, and so forth. Can fix a whole lot of things without having to have surgery, without having to do pain medications, or getting expensive imaging. So if you have any questions about this any further, feel free to give us a buzz. We'd be happy to chat with you about your particular problem and the uniqueness of your situation. And as always, we want to help you stay mobile and active and off pain pills. And so if you have any questions, feel free to give us a call, 316-558-8808 or bodyworksphysicaltherapy.net.